Can I prevent lifelong balding by getting a hair transplant, even if people at my father's and mother's sides are bald?
Thank you for your question. You submitted your question without a photo, and you're asking actually a very common question. And the question that you're asking is, can you prevent balding by undergoing hair transplant, even though both your mother's side and father's side of the family have strong history of hair loss? Well, I can certainly answer this question even without your photo, since a question like this comes up every day in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers. This is a system we developed as a non-surgical solution to help men and women with genetic pattern hair loss who are progressively thinning and have an opportunity to do something about that non-surgically. And this is a system that we developed doing hair transplants. And what we were doing was we were trying to use a material called acellular matrix combined with platelet-rich plasma, and we were able to find that not only were the hair transplants healing better, but also thinning hair became thicker. And I'll discuss some more details about that later on. So to begin with, it's important for you to also determine whether or not you are experiencing any significant hair loss. You know, a lot of times patients come to us who have family histories where both sides of the family have very good hair, and yet they have significant hair loss. And it's pretty much the issue, it's not just the immediate family that you can see, but it's the generations preceding that contribute to your genetic complement. And therefore, it is certainly not necessarily an absolute that because both sides of your family have significant histories of hair loss, that you're guaranteed to have hair loss, but the probability is fairly high. Now, that being said, I can certainly share with you the experiences of many people who come to us and come to us from around the world for treatment, who specifically tried the strategy of having hair transplant as a way to address hair loss from a very early age. We've had patients who have gotten hair transplant as early as age 20. And unfortunately, they still continue to progress. And I think it was very strange for them to get a transplant at such a young age. But more importantly, the counseling of a patient about the level of improvement as well as the longevity of that improvement with hair transplant is critical. As a general rule of thumb, we don't recommend hair transplant for anyone who is under the age of 30. And it has to do with essentially the different levels of aggressiveness of hair loss progression. We have patients who come to us who are, let's say, in their 40s, and they say they started losing hair in their 20s, and they can have just moderate amount of hair loss. Comparably, we have patients who are already, let's say, 30, and they started losing hair in their 20s, and they're practically bald. And so what you have are different levels of aggressiveness, of progression. And so my position is to be proactive and don't go for a surgical solution as your first line of treatment. It is arguable that people who have gotten hair transplant at a relatively young age, and even if they kept on doing it, they went for a second transplant, they went for a third transplant, eventually what happens is their donor area runs out. Yes, some people may have thick body hair and they may be candidates for body hair transplantation. But I basically explain that you have to look at the geometry, that the top of the scalp has a large surface area and the donor area is considerably smaller. Therefore, there's a mismatch between the source and the place where you can transplant hair. So my position, and again, someone who has done hair transplants for a long time, with hair regeneration, I found essentially an important, for a large group of patients, a window of opportunity while their hair is thinning to be able to manage their hair loss progression by essentially, depending on the patient, use technologies or systems to reduce the progression, rate of progression, such as with a pharmaceutical like finasteride, and stimulate hair growth. With hair regeneration, we have learned that we can reactivate hair that's not growing. And this is just a typical manifestation of progression of thinning. When hair is thinning, the hair growth cycles get shorter and the resting phases get longer. So in a given time, a lot more hair is in a resting phase. So when we come along and do our treatment, a lot of those hairs get reactivated. And that's what the regrowth part is. We can't regrow hair that's not there. And further, we're able to thicken thinning hairs and prolong the lifespan and growth cycle of those hairs. And we've been able to have a range of patients who have gotten benefit for years and years and years after a single injection treatment, but recognizing over the course of 8 years that there is a range of level of aggressiveness amongst different patients, that we've developed also a classification system. And that classification factors in current age, age of onset of hair loss, degree of progression, rate of progression, other pharmaceutical and other interventions patients have undergone, and other medical variables. And essentially we figure out a treatment plan. So for a lot of patients, especially if they're younger, I explain that it is better to delay hair transplant for as long as possible. The outcomes of hair transplant and the limitations of transplant in a way is almost designed really to help people who are in the 40s and older, because with the smaller amount of areas that you can cover, the appearance can be more consistent or age appropriate as opposed to the desired outcomes of younger people. So I think it is very important to understand this one principle, that hair loss is progressive. And a strategy that you want to employ, given the limitations of current technology, is a management strategy, and a strategy where the outcome is to maximize coverage for as long as possible. So learn more about pharmaceutical treatments as well as this new class of regenerative medicine technology that we can certainly take a lot of credit for helping establish. And I think you'll find that there are other options to employ more strategically before taking the step towards a hair transplant. So I hope that was helpful. I wish you the best of luck. Thank you for your question.